Them kids are not supposed to snore.
Kids also, they get sleep apnea.
All snoring are not sleep apnea.
Any patient came to you and complained about each other?
Wives say that we can't sleep well because you're snoring. They don't listen.
I suspected a severe obstructive sleep apnea. He's a policeman. So actually we lost the patient.
Hello everyone. A warm welcome to all of you on behalf of Birla Hospitals, CMRI, to this special podcast where we are mainly going to talk about sleep disorder, diagnosis and the treatment. And it's a pleasure of mine to have with me two eminent doctors from the field of pulmonology and ENT. So viewers, it's my request to you, do not forget to note down what our experts are telling you. So let me introduce first with Dr. Arup Halder, who is the sleep physician and very renowned pulmonologist. Also joining me, Dr. Arjun Dasgupta, who is having over 30 years of experience in the field of ENT and of course, who is known for sleep surgery as well. So my question is to you firstly, what is this sleep apnea actually is?
So sleep apnea is a medical term.
Okay.
It's a diagnosis where patient present usually with snoring, daytime sleepiness and witness choking or apneic. That means complete cessation of breathing during sleep.
Okay.
So this is a syndrome. All snoring are not sleep apnea, but if any patient along with snoring, if have a choking or daytime sleepiness or having multiple comorbidities like a cardiac comorbidity, having an atrial fibrillations, they are usually the patients of having obstructive sleep apnea.
That means if I snore excessively, that doesn't mean that I have sleep apnea?
Right. So snoring is a sound where there is a partial obstruction. Along with snoring, if there is an obstruction, that causes lower delivery of oxygen to the body or expulsion of the carbon dioxide from the body. This chemical imbalance actually causes many of the symptoms of obstructive sleep apnea. So simple snoring is not obstructive sleep apnea. You have to have all these symptoms together.
What are the red flags in that case, sir?
So as I've mentioned, snoring, witness choking or gasping during breathing, daytime sleepiness, and a sensation of fatigue throughout the day, using toilets multiple times at night, having a short-term memory problem, having a mood problem. These are usually the symptoms of obstructive sleep apnea where the patient has to consult a doctor.
Okay, thank you so much for letting me know about this. Sir, my next question is to you. What anatomical features do you look for in a routine exam that raise suspicion for OSA?
Well, snoring and sleep apnea is an obstruction. It's an obstruction of the air that we are breathing in and going to the lungs, and it happens during the sleep. So some of the obstruction is static, which is like fixed obstruction, which is always there. This is like deviated part of the nasal septum or maybe a polyp in the nose or big tonsils. They are fixed. But the part of it is dynamic. So basically it changes from time to time, especially during the sleep when we lose our muscle tone. So they come and obstruct it. And I just want to add one thing on Arup say. So this sleep apnea is a very recent phenomenon. It was discovered in the 1980s. First started coming into the literature. So when Sullivan invented the machine, the CPAP machine in 1980s. But is it truly an 80s phenomenon? I mean, didn't we know anything? I mean, if we look at Charles Dickens and the Pickwick Papers, some 100 years ago, and there was, it was called Pickwick syndrome. So there is a description of a man who used to snore sleep during the day and snore. So he was classic sleep apnea. If you look at our mythology, like Kumbhakarna, so there's a guy who used to snore and sleep throughout the day. Actually, if you go back farther, if you go back to all the ancient mythology, and they always knew that the breathing is essentially important for well-being. So it was called prana in Indian mythological or Indian thoughts. In China, it's called chi. In Arabic, it's most the important civilization always knew that it's important to have breathing, good breathing, if you want to have a good health. So they already knew that. So that's the whole thing about pranayam and the tai chi and all this. All these were there. So we have just inherited the technology, this knowledge, and we have really discovered that problem with breathing can be a serious problem, and it can affect sleep, and it's called obstructive sleep apnea.
So this is just it is my very personal question.
Sure.
That how do you understand that a pulmonologist will be treating sleep apnea, or this person needs a surgical intervention?
Actually, there is no red line that this part of it is due to the ENT. This is part is the pulmonology. So basically, in anything, if you look at the last 100 years, the medical science hasn't advanced hugely. What has advanced is the way we understand the disease. And one of the words of modern medical treatment is team approach.
Right.
So we now know that so one head think about it in a way, if there are 5 heads thinking about the same problem in a different angle. I mean, I have spent last 30 years with ear, nose, throat. So I have a natural bias of looking at a disease in a certain way. Arup looks at the disease in a different way.
Okay.
So these two minds coming together, and along with the sleep technologist and with the speech and language therapist, we get a whole 360-degree view. So the main thing is we approach the problem in a way, in a systemic manner. And whenever we face a problem, we sit together, talk to each other, that this is the problem. Do you have a solution for it? And most of the time, the solution does come out.
So viewers, point to be noted. So it is all about team approach, where you can have the holistic care under the same roof. So my next question is to you, Dr. Halder. So in the process of diagnosis, sleep study is the process to know if the patient having sleep apnea or not. So what do you suggest, home test or lab test?
So that's a great question, I think. So sleep study can be done at lab, or it can be done at home also. But where to prescribe the home study and where to prescribe the lab study, there is a lot of confusion about that. But the guidelines are very much clear-cut on this question. So if the patient having a very pre-test likelihood of having obstructive sleep apnea, that means his symptoms are very much prominent, his morphological features are like obstructive sleep apnea, you can go for a home study, provided patient does not have any sufficient comorbidities, like patient does not have any cardiac comorbidities, patient does not have any COPD, a complex COPD, or any other sleep disorders. So for these patients, you can go for a home study. But for all complicated obstructive sleep apnea patients, we have to go for in-lab study. Because in in-lab study, we do multiple channels where even subtle obstructive sleep apnea feature or some atypical features of obstructive sleep apnea can be caught in the study.
Absolutely.
Okay.
If I can add in here,
Sure.
So the more and more, there are about 80 to 90 kind of sleep problem, and obstructive sleep apnea is just one of them.
Okay.
And with the modern age, with COVID, with people's addiction with smartphone, and they spend a whole night scrolling through reels, doom scrolling as they call it, and insomnia, and people cannot sleep, or even if you go to sleep at 2 o'clock, you suddenly wake up and you cannot go back to sleep. They frequently now coexist. So neurological problems, psychiatric problems, and obstructive sleep apnea problems very, very frequently coexist. So we can't just see them one in a box, that this guy is a sleep apnea, this guy cannot sleep well in the night, this guy has got some other sleep disorder problem. It doesn't happen. So frequently they overlap, and you need to understand that for that, inpatient sleep study is probably the best way.
Sir, a very vital point you have raised. Now, if you kindly let our viewers know, after diagnosis of sleep apnea, what are the treatment plan, or what do you suggest for the patient to come out from this disease?
So the first treatment plan is always lifestyle modifications. If the patient is obese, he has to lose weight. We also prescribe myofunctional therapy. We call it a face gym. Some exercises are there which actually improve the upper airway muscle tone. They improve sleep apnea to a lot. And the gold standard therapy in most of the patients till now is a CPAP, or continuous positive airway pressure, or APAP, or automatic positive airway pressure. And few patients who are not tolerant to CPAP, or who are having symptoms with even with the PAP machine, or who have a detectable skeletal or soft tissue abnormality in the upper airway, they are being referred to surgeons for the corrections.
Okay, thank you so much for letting us know about this, sir. I want to know from you, sir, that what is this drug-induced sleep endoscopy during sleep
Drug-induced
studies?
DISE. The thing is, we need to find out where exactly the obstruction is. And if we know the level of the obstruction, it's easier to treat these patients. So as I was to further to my what I last said, that our anatomy is changing, and one of the reasons why our anatomy is changing is the process of food. So the burgers, cakes, and all this are soft. So our middle face is not developing. So we have a high arch palate, and we are developing these long palates and stuffed nose. And that used when people used to chew hard food, it wasn't there. So it's a more of a modern thing. So nose plays a huge role. So what drug-induced sleep endoscopy does is, when I'm talking to this person, say I'm talking to you or you're talking to me, maybe I snore, and you won't even know because I'm not snoring now. So we need to find out when this guy is snoring. So we give him some medicines and he goes off to sleep, and we pass a small camera down the nose to find out exactly where he's snoring from.
And that is not painful?
No, not at all. He will be asleep anyway. So he may have some ticklish phenomenon. So that's all really. Not at all painful, but it gives us a very valuable understanding where exactly is the snoring coming from, which we won't be able to detect anyway soon. Say something like there is a flap valve kind of thing over our voice box called epiglottis. See, if that is falling back during sleep, there is no test will determine it under that putting him to sleep and passing the camera. And finding out, we tabulate it, and then we can offer the treatments accordingly.
Okay. We are having a very serious discussion, but still I would like to know any funny incident. Any patient came to you and complained about each other?
I had one patient who worked in a government hospital. He used to fall down with his chair, along with his chair. And his colleagues brought him in.
Oh my
and
God.
I have a couple of, it's actually quite sad, and we laugh about it. It is laugh about it because there are guys, say that's social. I mean, the wives say that we can't sleep well because you're snoring. They don't listen. But when they're traveling in long distance trains and in the co-passengers, I have got patients who were kicked out of the train in the middle of night in Bihar, in absolutely desolate stations. So that has like shaken them like anything, that I need to do something about it. That trigger is because they are not their wife, he's not, you have to pay attention to them.
True. Why they will?
And when we travel long distance in the train, I'm sure you have met
There is one person in the whole many instances where
one person's in the whole coach who is going to snore so loud.
You will find
the rest of the coach is
untreated. I would call untreated.
Absolutely.
And sir, from you, if I can have a story.
Not funny incidents. So I lost one patient whom actually is a 33-year-old patient whom I suspected a severe obstructive sleep apnea. He's a policeman. And every visit, he used to come to us with his mother to actually show her. And the physical morphology of the patient was such that he's having obstructive sleep apnea. You can diagnose from just looking at the face itself. So actually, we lost the patient. His mother is still surviving. She's being treated for other disorder. But even after repeated requests, he have not done any sleep study. And one night, he suddenly died during sleep.
So, for my viewers, now you can definitely understand how vulnerable it is.
Yeah, one of the things is, if you question yourself, why all the strokes and the heart attacks, they happen during this morning hours, like half night. And why is that? Why they can't have a heart attack in the middle of the day? They don't, because of sleep apnea.
Okay, got that. So what is the biggest misconception about surgery for snoring?
The biggest misconception of the surgery is not going to cure anything. Surgery does not cure sleep apnea. I mean, I must be honest, there has been some cowboy surgeries where uh, there cannot be any one fixed surgery for a person. I mean, that was probably the wrong approach before.
Okay.
If you do one surgery on everybody, then probably it's going to fail. So we need to find out. That's what the drug-induced sleep endoscopy come in, where exactly you need to find out how we can help this. Is it the nose? Is it the palate? Is it the tongue? Is it the epiglottis? If it is the tonsil, if you really identify that, then if the obstruction is so severe that he cannot even tolerate a CPAP, then it does help.
Okay.
And especially for the kids. I mean that's one of the things that I want to point out. The kids do very frequently suffer
Kids
from
also, they get
absolutely
sleep apnea.
very, very severely. I mean, for the adults, like he was describing, I mean, one of the adult symptom is they feel doze off throughout the day. They feel sleepy during the day. The kids, it happens the opposite. They become hyperactive.
Okay.
They just run around. They can't put attention because they are not having good sleep in the night, and they are reacting in a funny way. And for the kids, surgery is like a must. I mean, like you take the adenoids and tonsils out, and they are cured more or less. These kids, we used to do like tonsillectomy for infection, tonsillitis. We hardly do it nowadays. Nowadays, most of the tonsils operations or adenoid operation, adenoid is something like the tonsil at the back of the nose. We do the surgeries mainly for sleep apnea, for obstructive reasons.
And sir, if I just can know from you that in this pediatric population, what is the cause? What are the cause?
The causes are adenoids and tonsils,
these two.
and soft
Not
food and
obesity.
chewing. No. Obesity is mainly for adults.
Yeah. So
For
obesity
kids,
is now also increasing in the pediatric age.
They are. Of course, they are. But for kids, usually the tonsil and adenoids, they kind of regress by 8 to 12 years old.
Okay.
But more and more people we are seeing with the environment and everything, they are not disappearing.
And this is also very common in the syndromic child, especially the Down syndrome, myotonic dystrophy.
Especially challenged.
Yeah, so it's especially challenged children. They often have various kind of sleep problems, and if you treat the sleep problems, their IQ level increases.
Okay.
Absolutely.
So that is very important.
They can have a better
yes,
life.
Absolutely.
Right.
And the same way I can say that there is the children are getting diagnosed as attention deficit disorder, right, left, and center.
Okay.
But we are seeing them again and again that many of them are actually suffering from sleep apnea, and by surgery their attention span has improved. I mean, we are not qualified enough to diagnose whether the person has ADHD or not. But what I can say is, unless we rule out sleep apnea, when the children is really suffering, cannot sleep in the night, and they are hyperactive, unless we treat their adenoids and tonsil, we cannot label them as ADHD. That has to be done first.
And sir, you were talking about CPAP. So in that case, I would like to know from you. So I know a person, there is a family member of mine who is having sleep apnea and still very rigid of using this CPAP machine. So how do you counsel a patient for this CPAP?
So that's a major challenge actually before starting any treatment with the CPAP, because that's a foreign machine you have to wear every night throughout your life, because there is a control of the disease, there is no cure for the disease. So we have to counsel the patients properly before initiating any CPAP therapy.
Okay.
We have to tell them, so this is a machine which will splint your airway open during sleep. It does not deliver oxygen. It will just open your closed airways. You have to wear it every night for more than 6 hours at least. And if you wear it, you will have an improvement of the cognitive symptoms, your daytime functioning, your comorbidity risk will decrease, and possibly your medication will also be a little bit lower.
Okay.
And if we can counsel the patient well, if you can give them a comfortable mask, and if you can adjust the pressure in a tight controlled way from the beginning, I think most of our patients are then compliant. And the compliance, you have to measure every 3 months or 6 months thereafter, because a measurement of the compliance during the follow-up actually improve the future compliance of the patients.
But why this reservation, sir? Is it very painful
no, it's not
very
painful.
uncomfortable?
It's just a mindset.
Okay.
So you have to wear a machine, you have to plug in,
Sure.
you have to wear a machine, you have to carry the machine.
Okay.
Okay, so that's the mindset working.
Which I find a bit odd actually, because in the population that we are working is very averse, surgery averse. The first thing, if you prescribe them any surgery, like ear surgery, nose surgery, they will say that, is there any medicine or something I can do
That's the
not
thing.
to have the surgery? And you have to talk to them in a very open way. But with this, their averseness, I think the way there is a natural rebel inside you, and whenever something is prescribed that for your life, they kind of become averse to it naturally. But if you counsel them properly and you can listen to them, most of them can be.
So I think this is the platform we are having, and I would request you a message for our viewers, where you will be talking about sleep apnea and the CPAP machine, how people can get the benefit out of it.
So if you have been diagnosed with obstructive sleep apnea, then you have to use the machine or CPAP or AutoPAP. Before purchasing the machine, go for a sufficient amount of trial with the machine, where you will sleep with the machine at your home, at your own comfortable position, and the doctor after 3 days to 7 days will see a compliance report which can be bought from the machine itself. So if you are satisfied that your sleep is better with the machine, and the doctor will tell what is the AHI, that means the apnea hypopnea index being caught in the machine, is it less than 5? So if they both are satisfied, then you can go for the machine. You have to use it for lifelong, unless you are obese and you can lose a substantial amount of weight. So that's a mindset you have to be from the beginning, because like any other medications, like a diabetes medication, hypertensive medications, you have to take it every day. So these machines have to be taken every day. It will improve many of your symptoms. It will reduce the mortality.
Thank you so much, sir. So I would like to know from you, sir, is there any new technique that excites you to treat this OSA?
I mean, there is a lot of things coming on.
Okay.
As he said, that there is it's a overweight, obesity is a big part of the problem. So there is a huge part of obesity drugs and bariatric surgery which is coming in, which is not done by us, but it's quite promising. Even with non-diabetic obese patient, it's important. There is a pacemaker coming in, which I went to the Mumbai and I saw it myself. Hypoglossal nerve stimulation is very expensive, but like most of the technologies, as time goes by, the price starts falling. And there is the dental people are coming up hugely, giving braces, like kind of things. And some people are quite well tolerated. So it's not one size fits all. It's not just there is only one treatment, or there is one surgery or one medicine. So there are some medicines on trial. I think Arup must be aware of it as well.
So that's a very exciting field. Next 10 years will be very exciting for obstructive sleep apnea, because we are now phenotyping the patients, phenotyping and endotyping. That means dividing the patients into different groups, where a set of pathological reactions is actually causing obstructive sleep apnea. So if we can divide that, we can actually prescribe few medications. Suppose if the patients have a poor muscle responsiveness, there is one medication which is now in phase 3 trial, atomoxetine oxybutynin, which has done marvelously. If the patient is overweight, so the tirzepatide, as being mentioned by Arjun, so these are doing a lot. So various kinds of medications.
The future is very good. But just let's not box ourselves. Let's open up. And most importantly, as an ENT surgeon, I want to give a message that if you have a blocked nose, and if you please see to it, because the transition is it happens naturally. The people with blocked nose who ignore most of the symptoms, they do get up and they end up having obstructive sleep apnea. If your kids are snoring, don't ignore them. Kids are not supposed to snore. So there is a problem. So please don't ignore them at all, and come to the doctors. And that there are pulmonologists, there are ENT doctors, there are dental doctors. All together, there are various ways we can fix it, and it does not mean that it has to be painful or expensive. Not that there will be a solution.
piece of advice from you as well, sir?
Yeah. So we have World Sleep Day on 13th
Yes.
of March
Yes.
in 2026. The theme is that sleep well and live better. So if somebody has a snoring, so that is an alarm bell of ill health. So snoring, choking episodes, or gasping for breath during sleep, and daytime sleepiness. If somebody has symptoms, please visit to a doctor, because these are signs of obstructive sleep apnea that can be corrected and also controlled with the modern medications.
Thank you so very much
Thank you.
for joining me. And thanks a lot on behalf of CK
Thank
Birla
you.
Hospitals, CMRI. And
Thank
I'm
you.
sure all our viewers are going to be benefited after watching this podcast. So see you next time. And I wish you all the best. And we wish you happy World Sleep Day. Thank you. Thank you so much.